Hi, I'm Tony Waycaster and doing week 3 blog about leadership. The first question is what skills described in chapter 7 and identified on the leadership skills questionnaire would I use to secure needed resources such as staffing. The leadership questionnaire did show me high in administrative skill, second high in interpersonal skills, which I feel like I'm fairly good at. Skills in chapter 7 that I use daily are planning, organizing, and staffing. As a clinical manager, I tend to have a helicopter view of our patient care in the home. I'm also always planning ahead, looking to what might be needed in staffing or just overall care. Staffing is something that we look at day to day and often hour to hour. Organization is often used due to the level of patient care that we provide in the home. We always have to be organized and make sure our patients have what they need in the home. How would I use the Polish literature in this process? I would use a team approach to obtain resources that are needed for staffing. I'd also use an interdisciplinary approach to providing care. Studies have shown that whether dealing with education or clinical care, an interdisciplinary approach is most effective. An example of this was given in an article titled An End-of-Life Care Interdisciplinary Team Clinical Simulation Model. This article discussed the ways that nursing students were taught about end-of-life care by using an interdisciplinary approach. At the conclusion of this course, the student satisfaction for this course was very high based on the course curriculum. Identify the levels and departments that I would need to work with in order to be effective in my role. Currently, I am a clinical manager for hospice. In my current role, I work with an interdisciplinary team consisting of a physician, RN, social worker, chaplains, and volunteers. We meet weekly to discuss our patients so that we can provide the best care for them. For the health system that I work with, I work directly with different levels of management. I worked with the executive director in our office. I worked with the director of hospice and the chief nursing officer for our organization. I feel I'm very effective in my job because of the many levels of leadership and management that I work with. Explain how, if you feel you would have a preference of vertical or horizontal. We currently use a horizontal structure for leadership, and this seems to be effective. Our clinical team has open lines of communication to myself and the executive director in our office. We are part of a health system, so there are 2 to 3 more layers of management above me prior to being at the chief executive officer for the health system. I hope you enjoyed this and have a good evening.